Hello everyone, welcome to another NP Academy lecture. Today we will talk about mode of action of some of the most common antibiotic that we use on daily basis as a nurse practitioner. So we will talk about antibiotics and how these antibiotic works, the mode of action. As you all know, antibiotic kills bacteria. So let's draw the structure of bacteria. Bacteria is made up of a cell wall, that's the outermost layer of bacteria, and these cell walls are made up of in multiple layers, and each layer of this bacterial cell wall is made up of something called peptidoglycans. Peptidoglycans, and there are multiple layers, but for the sake of simplicity we will draw here two layers. So each layer is made up of peptidoglycans. Peptido means protein, glycans means carbohydrate. So basically there is a protein and carbohydrate, and these layer is cross-linked by a small little peptide, and these peptides are made by an enzyme called transpeptidase. So transpeptidase cross-link this bacterial cell wall to make it a little stronger. Well, right beneath this cell wall is something called cell membrane. So this is your cell membrane of bacteria. If you remember correctly, in the eukaryotes they also have a nuclear membrane, and inside the nuclear membrane is nucleic acid, while in the prokaryotes there are no nuclear membrane. So under this cell membrane is your nucleic acid, and nucleic acid is made up of your DNA. And if you remember the basic molecular biology, the central dogma of molecular biology is this: the DNA make their own DNA, and this process is called replication. Then your DNA forms RNA, and this process is called transcription. And then your RNA forms protein, and this process is called translation. And the protein synthesis happen on something called ribosome, and ribosome has two subunits. One is the smaller subunit made up of 30S, and larger subunit made up of 50S, and then there is this mRNA as a part of protein synthesis. This is your mRNA, and then something called tRNA, called transfer RNA. This tRNA transfer the amino acid to the protein synthesis site here, and here these individual amino acids get linked by a peptide bond to form the protein chain, and this is your protein. Believe it or not, most of the antibiotic that kills bacteria, they kill the bacteria either by disrupting the cell wall, or the replication, or transcription, or translation. These are the most common one. So let's look at it. The most common antibiotic, our oldest antibiotic in this class, is your penicillins. Penicillins kills bacteria by disrupting cell wall synthesis. No cell wall, bacteria dies. What are the most common antibiotic in this class? Is penicillin itself. Your PenVK is your oral antibiotic. Your amoxicillin, we use it a lot. Your augmentin, your zosyn, these are some of the most common one. Okay, then there is another antibiotic, is something called vancomycin. Vancomycin also kills bacteria by disrupting your cell wall synthesis. Where do we use Vanc? Vanc has a MRSA coverage. This is your bigger antibiotic. Most commonly IV use. We use it whenever patients are in the sepsis, specifically when we suspect the MRSA infection. We use Vanc PO to to treat C. diff. This is the only place we'll use most commonly as a PO when to treat C. diff. Then there is another large class of antibiotics, something called cephalosporin. Cephalosporin also kills bacteria by disrupting your cell wall synthesis. And cephalosporin has like 5 classes in it as of now. Some of the most common antibiotic in this class that we use is your Keflex for simple cellulitis, for UTI. Then you have a Cefdinier, this is your third generation, we use for the ear infection. Then you have a Rocephin, this is also third generation. Rocephin is the drug of choice for community acquired pneumonia. We also use Rocephin to treat gonorrhea in the case of STD. So these are some of the most common ones. Then you have one topical antibiotic called Bacitracin. Bacitracin also kills bacteria by disrupting cell wall synthesis. And as I said, this is topical, so we use it maybe after laceration repair. We also use this for the simple burn. For the complex burn, we use Silvadene, but for the simple, we use this. So these 4 classes of antibiotic kills bacteria by disrupting the cell wall synthesis. Now we have 2 different classes of antibiotic that kills bacteria by disrupting DNA replication. What are those? One of them is your Fluoroquinolone. Fluoroquinolone kills bacteria by disrupting your DNA replication. And the 2 most common antibiotic in this class is your ciprofloxacin. Cipro has a very good gram-negative coverage. We use this to cover your pyelonephritis, to cover diverticulitis for the gram-negative coverage. Other one is your levofloxacin. This one we use as a monotherapy to treat the community acquired pneumonia. Now fluoroquinolone has some bad reputation. It has a side effect of QT prolongation, tendon rupture, so there are some black box warning from FDA, so we do not use that very often, but it's a wonderful drug. Other antibiotic is your Flagyl. Flagyl also kills bacteria by disrupting DNA replication. And where do we use Flagyl? We use Flagyl for the anaerobic coverage. It's a wonderful drug. Specifically, we use in the intra-abdominal cavity. So when we treat the diverticulitis, we use Cipro to cover gram-negative and Flagyl to cover anaerobes. Flagyl we also use in the GU infection like PID, STD, BV to cover anaerobes. So these 2 antibiotics disrupt the DNA replication. Now we have a few antibiotics that disrupt your protein synthesis, and that's how they kill the bacteria. What are those? So one of them is your Macrolide. Macrolide kills bacteria by disrupting protein synthesis, and specifically Macrolide block the larger subunit of ribosome. And what are the macrolide that we use often is your Erythromycin. It has a very good atypical coverage. We use Erythromycin along with either Rocephin or Cefdinier or Augmentin sometime to treat your community acquired pneumonia. The other one in this class is your Erythromycin that we use to treat the conjunctivitis, the pink eye. These are the 2 most common. Then there is another antibiotic called Clindamycin. Clindamycin also disrupt protein synthesis by blocking the larger subunit, the 50S. So clindamycin and macrolide, they both have the same mechanism of action, but they both are 2 different classes of antibiotic. Clindamycin does not belong to macrolide. Where do we use clindamycin? Clindamycin also has a very good anaerobic coverage. So general rule of thumb is that when you have an anaerobic coverage below the diaphragm, like in the intra-abdominal or GU infection, we use Flagyl. Anywhere else, we use Clindamycin, like in the dental abscess or anywhere else. I like not to use Clindamycin, mainly because of all the antibiotic, this has the high chances of causing C. diff, but otherwise it's a good antibiotic. The other antibiotic is your tetracycline. Tetracycline. This class of antibiotic kills bacteria by disrupting protein synthesis, and this block your smaller subunit, this one. And which is the antibiotic in this class that we use all the time is your doxycycline. It's a wonderful antibiotic. It covers a lot of atypical things. So like for the Lyme disease, we use this. For the Rocky Mountain spotted fever, we use this. For the Q fever, we use this. Interestingly, it also has a gram-positive coverage and gram-negative coverage as well as MRSA coverage. So I also use it to treat cellulitis or abscess where I do not want to use the Clindamycin. So this is my go-to drug, and so far I have had a very good luck with the doxycycline. And one more class of antibiotic that disrupt the protein synthesis is your Bactroban. Bactroban kill bacteria by disrupting protein synthesis, but Bactroban block your this tRNA. And where do we use Bactroban? To treat impetigo. And Bactroban also has a very good MRSA coverage. And this is also topical. It's a topical antibiotic. So when it comes to topical, the two common we use, one is the Bactroban and other one is the Bacitracin. So wherever I suspect MRSA, I use Bactroban. In impetigo, I use Bactroban. Otherwise, I use Bacitracin. So this is the few antibiotic that disrupt the protein synthesis. You might be wondering, when these antibiotics affect the protein synthesis of bacteria, why these antibiotic does not affect the protein synthesis of host like us? And the reason lies into the ribosome. In the eukaryotic system, in us, the ribosome made up of 40S and 60S. It's different than 30S and 50S. That's why these antibiotic does not affect our protein synthesis. Now you have two different antibiotic that affect your folic acid synthesis. So let's look at the folic acid synthesis pathway. The folic acid synthesis starts from this compound called para-aminobenzoic acid. And the first step is they form dihydrofolic acid. And then the second step they form folic acid. And then this antibiotic that is your sulfonamide blocks your first step, this step of folic acid synthesis, and then there is no folic acid. So then there is another antibiotic that is called trimethoprim. Now let's use the black color. Trimethoprim block the folic acid synthesis by blocking the second step. So sulfonamide, first step, so there is no dihydrofolic acid, there is no folic acid. Trimethoprim, they block the folic acid in the second step. Now where do we use it? We use this two antibiotic as a combination product, and we use this something called Bactrim. Bactrim is nothing but it has a two antibiotic in it. It's a sulfonamide and trimethoprim. And the most common we use is a DS. DS strand for double strength. There is also single strength that I never used. Where do we use Bactrim DS? We use it to cover UTI, very nice antibiotic, as well as MRSA cellulitis. Wherever we suspect the cellulitis with the MRSA, we cover Bactrim DS. So these are some of the most common antibiotics. So believe it or not, as a nurse practitioner, you will be using these antibiotics rather on daily basis. And now you know how these antibiotics works. So this is it for today. Thank you very much.